Good evening, and thank you for joining us. McLaren Flint's Diversity and Inclusion Committee, along with McLaren Health Plan, have partnered together to bring you a dream team of panelists. I would like to give folks a few minutes as they enter into our site because we have so much valuable information. I would hate for anyone to miss anything. One of the nice options that we have available for this webinar is we have interpreters that will be doing American Sign Language. In order to get access to this resource, you must be using our Zoom platform. In order to get to our Zoom platform, you would have had to register at mclaren.org/Flint Fight COVID. Today, we're going to spend some time talking about the myths, the concerns, and the truth about the COVID-19 vaccine. This virtual webinar is live, and we will take questions directly from our audience. However, we will have other options available for those who may have questions that we don't have time to get to in the first hour that we are going to be presenting. And I say first hour because I believe that although this webinar will only be an hour, we will have to do multiple webinars over the course of the next few months as we get new information about the vaccine and the virus. I have two disclaimers that I want to talk about while everyone is logging on. The first one is, as you know, information is changing daily about the COVID vaccine and the COVID virus. The information that we are providing to you today is accurate as of February 10th, 2021. The next disclaimer we have, neither myself or any of the panelists will receive any financial gain from the information that we are providing today about the vaccine. Because the webinar is being recorded, it will be available via our Facebook platform and multiple McLaren websites. My name is Dr. Nicole Franklin. I will be your host/moderator for tonight's event. I'm a board certified health psychologist, an Air Force veteran, and the assistant medical director at the McLaren Bariatric and Metabolic Institute. During the pandemic, I worked on the front lines, providing psychological first aid to those who were impacted by COVID-19. I saw firsthand just how vicious this virus can be. Our goal tonight is to save lives by providing the community with information about the vaccine that is based in science so that they can make an informed decision about what is the right choice for them. Our agenda tonight is very, very ambitious, but I know I've been preparing, my panelists have been preparing, and we are ready to answer as many questions as we can and get information out there so that we can save lives. We will start with talking about some of the myths that are associated with the COVID-19 vaccine. We'll talk about the concerns, and then we'll end with the truth. Throughout the webinar, we will take pauses and ask or have you ask questions to our panelists about various things that you're concerned about. We've already received a few questions from our phone line and are prepared to answer those once we get to that segment of the webinar. For questions that we're not able to answer during our webinar, we will still be reviewing those questions. And there is actually a form that is going to be on the same website that you registered, mclaren.org/Flint Fight COVID, where you can submit your question and somebody from our medical team will email you back with an answer. So don't get discouraged if your question doesn't get answered during this webinar. We will still be available to provide the community the information that they need. I have mentioned Dream Team quite often, and I am so honored to have the panelists that we have today. First, we have Dr. Dennis Perry. He's a physician in the Lansing area and also the Chief Medical Officer at McLaren Health Plan. We have Bishop Urundi Knox, pastor of Ebenezer Ministries. We have Dr. Randall Taylor, who is Director of Pharmacy at McLaren Health Plan. We have Asa Asencio Zucaro, who is the Executive Director at the Latinx Technology and Community Center. We have Dr. Pamela Hackard, who is the Medical Health Officer for the Genesee County Health Department. And last but definitely not least, we have Dr. Lawrence Reynolds, who is the Medical Advisor to the Flint Mayor and Genesee County Board of Health. While you're typing in your questions, we're going to get started with addressing some of the myths that exist about the COVID-19 vaccine. Dr. Perry, I'm going to start with you. Often I hear individuals say that they don't want to wear their mask or they don't have to wear their mask because they've already had COVID-19 and they can't get it again. Is that true?
So thanks for the question. Like everything else that's been questioned since this virus entered our hemisphere a year ago, the answer to that is yes and no. So if you've had COVID-19 and you've recovered from it, your immune system has developed a response to it, and you are, for some period of time, immune to having it again. But there are some conditions where you can be at risk, and it's important to talk about those. The reality is that we're not sure how long you have immunity. So right now, it's felt that 90 days is probably realistic. More than likely, it's up to 6 months, but we don't know for sure. And no two people's immune system responds the same way. So again, we don't know. Also, folks have certain immune properties that might make them more susceptible. There are folks that we have that are taking chemotherapy and their immune system's affected, they could get it again. And then most recently, we've been reading about variants. So it's common for these viruses to mutate over time. We see that with every other virus. That's why folks who get a cold one year can get a cold the next year, even though they develop immunity right after they've had the cold and probably won't get it again right away. They can get it again a year later. And we're seeing that already with COVID. It's been with us for a year. We're reading about variants. There's at least 4 that have been described and watched and are probably all in the United States. So if you've had the original strain of COVID and now you're exposed to somebody who has one of the variants, theoretically you could get it again. So the reality is that in order to protect yourself, and just as importantly, to protect your loved ones, your family, your friends, you need to still be cautious. That's also why we recommend getting the vaccine, even if you've had COVID virus.
Dr. Perry, I have a follow-up question to that. Is there a certain amount of time that you would want individuals to wait after having the COVID-19 virus before they got the vaccine?
Right now, the recommendation is that if you have a present case of COVID virus, you should not get the vaccine. 2 weeks afterwards, you would be able to get the vaccine.
Thank you. So many people are concerned about the safety of the vaccine. Dr. Taylor, can you tell us what the difference is between emergency use authorization and approval from the Food and Drug Administration?
Yeah, sure thing. So the EUA, or Emergency Use Authorization process, is slightly different than the traditional FDA approval process or clearance for medical products or drugs, or in this case, vaccines. An emergency use authorization is a mechanism to facilitate the availability and use of medical countermeasures during public health emergencies, such as the one we're currently in right now with the current COVID-19 pandemic. So under an EUA, in an emergency, the FDA makes a product available to the public based on the best evidence available at the time, without waiting for all the evidence that would be needed for a traditional approval or clearance. Now, it's important to note that no clinical trial was sacrificed to get these products to market early, and these vaccines went through the same rigorous safety and effectiveness standards as all other vaccines in the United States. So that means the only COVID-19 vaccines available in the US are those that have gone through these same rigorous clinical trials and that. Forgive me, I didn't mean to say but yeah, so it's important to remember that these have gone through the same rigorous trials, large trials that these companies have provided for these vaccines.
Thank you. Dr. Reynolds, many people are concerned about the side effects of the vaccine. I've even heard individuals say that they can get COVID-19 by taking the vaccine. What are some of the common side effects related to taking the vaccine?
Well, I will share with everybody, I just had my second Mrna vaccine. And with the first vaccination, all I had was a little tenderness within 12 hours and fatigue that lasted about 18 hours. And I will say maybe I was just being lazy on a Saturday, but fortunately I was able not to have to go to work or do grandfather duty. I just got my second one Friday, and I will say I had a few more side effects. I did have the usual pain and tenderness at the injection site, no redness. I did have the fatigue. About 12 hours later, I did have a low grade temp. It was about 99.9 to 100.2. I just wanted to see how long I could go without Tylenol so I would know exactly what I could say today. But by about 8 hours of that, I decided it was time to take Tylenol. And I only had to take 2 doses. So what I'm saying, within 16 hours, it cleared up. And actually the fatigue started to abate also. So in an ideal circumstance, if you can take the next day off, or if you can at least not make any heavy duty commitments for the 24 to 36 hours after your vaccination, that would be wise.
And I'm glad that you shared you had the vaccine. I've also had the vaccine, both shots. Did you say you did Moderna? I did Pfizer, and I had minimal side effects. The only one that was a little troubling was just the fatigue the second day and a little soreness in the arm, but nothing different from what I typically get when I get my flu shot. And when I compare what I went through with getting the vaccine compared to what I've seen individuals go through in ICU with COVID, I would take the vaccine 100 times over.
And might I add, my 92-year-old mother got her first Mrna vaccine Sunday, and she actually came through with no problems at all. My 86-year-old uncle down in Florida got his second Pfizer vaccine, and yes, he did have a headache, and he did take Tylenol, and that was after the first 24 hours, and within another 12 hours, that resolved also. Now, they say these things can last as long as 2 or 3 days, but just for those circumstances where I've been able to interrogate people, usually by day 2, you're about 95% normal, and by day 3, you should be back to normal.
Dr. Reynolds, before you go away, I want to ask you a question that came from one of our community members. They are asking if one of the vaccines has been identified as being better for seniors.
Well, I can only speak as a clinician and as a community physician based on the two that are available. They are equally good. So my message to everybody is get what you can get as soon as you can get it. I don't recommend waiting, although there are some people waiting. And yes, there will be several other vaccines coming down the pipeline. But let me tell you, to sort all those things out and make sure you get it in your arm, that's a whole different kettle of fish.
I agree. I have another question that has come in. Dr. Hackard, I think that this question would be a great one for you to at least begin to address. I have someone who is wondering if there are any plans for vaccine distribution for individuals who are not able to get out of their homes.
Yes, we do have plans with that. We're working with the 2 FQHCs in the county, which are GHS and Hamilton. We are doing redistribution of our allocation from the state. We have started that. I've asked for confirmation as to how many people. We just started that last week. I've asked for confirmation of how many of those doses actually went to homebound, but those 2 facilities have the ability to do mobile units at this time. So those are the plans in place. We are starting to do that. We need to get the feedback for that. Also, we are starting to do a ride to wellness program that could allow people to sign up if they just have transportation issues, but not the health issues. And they would be able to get a ride from their home and actually do a priority pass through the drive-throughs and stay in the car and have that as well.
I have another question. Are there any concerns with breastfeeding mothers getting the vaccine?
I'm happy to take that if you'd like.
Sure.
No, they are recommending that breastfeeding mothers do get the vaccine.
I have another question, and I'm not sure who would like to answer this. I have an individual who says they were diagnosed with COVID-19. They did the quarantine period of 14 days. They got tested and they still had COVID-19. They don't know what to do. Is it safe for them to be with family or should they continue to quarantine?
So I'm happy to take that. As of December 30th, I was actually working at Henry Ford Hospital as an occupational medicine physician and treating COVID patients directly in my clinic. So I had that question come up quite a bit. And the viral burden is not high enough actually to spread it. There's 2 things that could be happening. You could have a very, very low viral burden so isolation, 10 days of isolation now, between 10 and 14 days. So we definitely recommend that you still try and stay away from friends and family between days 11 and 14. But if you do, make sure you're socially distancing with the mask on. After day 14, it is not felt that the viral load is high enough to transfer it. And quite a few people, like the majority of people will have the virus non-detectable around day 18 by the nasal test, the PCR test. But you can still pick it up intermittently and it could represent like dead viral particles or very, very low levels up to day 45. So don't worry that once you have passed the day 14, so you'll be told to stay home in isolation for 10 days. But then from days 11 to 14, you should still continue to be very, very cautious with mask use and no physical contact. But after that, really, it is not thought to be transmittable.
Thank you. During the pandemic, concerns about our mental health have been on the increase, and many individuals use their faith as a source of comfort. Bishop Knox, what situations or events are members of your congregation facing related to COVID-19 that may impact their mental health?
Well, I'm going to say, first of all, thank you for allowing me to be a part of a dream team. I never would dream that I could be a part of a dream team. So thank you for allowing me to be on tonight. But as a faith community, we have truly been in a period of time where our faith has been tested. If you look at it first and foremost, we were still trying to recover, cope with the water crisis and the negative impact it placed on our lives, from having to boil our drinking water or having it delivered case by case. And now with that in mind, how are we able to even water baptize or be able to baptize next to one another? How are we able to fully immerse someone, which was a symbol of our faith, and expect our congregation to comply? And now, this global pandemic, once again, we're faced with something that we didn't have a playbook to refer to, nothing to guide us through. But our leadership noticed that there were similarities in our congregation with mental wellness, with the water crisis and this pandemic. We noticed a pattern of non-clinically diagnosed anxiety, depression, and or PTSD, or post-traumatic stress disorder. Many parishioners began expressing intense anxiety regarding gathering in the sanctuary for Sunday morning or Wednesday night services. So we had to immediately pivot and limit and monitor the number of individuals allowed in our service. We had to practice all of the CDC guidelines for gathering in public. Our congregation also lamented that they were reluctant to send their children to school and were looking for answers from us as faith leaders to do more than just pray. Therefore, we reached out and searched within our community and built an online program focusing on mental health and mental wellness. We changed the narrative in our church regarding the stigma of mental wellness. We contacted the Inner Center and utilized their professional counseling services. We created a safe space within our community. We continue to make sure that we had information going to our people each and every week. We wanted to post something so that they can receive information. People were feeling isolated. So we had to create a 30-minute program, which we entitled Mind, Body, and Spirit, which was aired weekly online and hosted by Candace Machat. The program taught us how to eat healthy, practice yoga, use meditation and mental wellness techniques. In addition, we created a weekly program called Perspectives, which we posted to Facebook, and it tackled the hard questions of mental health issues of adults, and mind this, and children, because they also felt isolated. And we noticed that suicide rates were up, not just in our area, but in the world in totality. This was led by one of our lead instructors, Elisa. Her name is Lisa Horn. She was our mental health expert, along with a person by the name of Dr. Danica Perry, who now practices and resides in Delaware. But I digress. The main thing we noticed that our members face in this COVID crisis has been the fear of contracting the disease and that of facing their own immortality. We had members that tested COVID positive who were extroverts, and in many cases had now came to the conclusion, how will I react once I return back to my new normal? Can I hug people? Can I touch people? Will those same people who know that I had COVID, will they be able to touch or hold me ever again? So beyond the medical treatment of COVID, our church took the stance that mental health is just as important as physical health. Listen, one last point, please. We had people who lost loved ones and people who could not see their loved ones that were hospitalized. We, the church, could not hold traditional funerals for the family or for friends. We couldn't even offer physical support. That was yet another pillar of the church. It was destroyed during the pandemic. Therefore, we had to create a mental wellness program, which I would recommend every congregation to consider. We can't get through this with prayer alone. We need our mental health care professionals, and I applaud them, as well as those that are on the front lines dealing in the hospitals and the EMTs and all those that are working in the healthcare field. Thank you.
Thank you, Bishop Knox. That is an amazing program that you have put together. I went to your website and saw some of the resources that were available, and they are top notch. I mean, you are really doing some amazing work out there in the community. Thank you. Thank you.
Thank you.
Mr. Asensio Zucaro, can you please tell me some stressors that folks in the Latinx community are experiencing as they confront the coronavirus and what we can do to help.
Absolutely, absolutely. And as well, thanks for having me on your panel tonight. Like I said, my name is Asa Santos-Carl. I'm the director at the Latinx Technology and Community Center. So greetings to Dr. Franklin, greetings to our panelists, and greetings to our attendees. But absolutely, so what we see here at our community center is really this connection with the realities and the experiences that community members are going through as we navigate as a community through this pandemic. And one thing that we see just kind of as a pattern for many different families is the overall change in the social dynamic, which has really created financial insecurity for many of our families. We have some individuals, right, that are at high risk if they were to get the test positive for COVID-19. That has caused them to reconsider their position, their job, or what they do. We have people that are out of work because a business is closed or has scaled back. And then as well, when it gets more complex, we have family members that have had to make the decision to stay at home to support their children in virtual learning. We see that there's many different reasons that have shaken families and their financial security. We see that education is a concern for a lot of families that we serve. I know a lot of them are concerned for learning loss or the amount of information that their children are learning during this time. I know we get a lot of contact from parents on how they can be more supportive of their children. And specifically when we talk about, a big focus on the population that we serve, the Latinx community or the immigrant Spanish-speaking community, is we see these different barriers of how language can be a barrier. How can you be an advocate or support your child's education when, if everything's, in a language that you don't speak, or these cultural barriers, just trying to understand how to navigate the healthcare system in the United States or the programs that exist right now. And then lastly, just any immigration barriers. When immigration is a barrier, it makes it really difficult to access programs or services, or as well to make sure that you have that stability in your life to continue to have a good, positive quality of life.
Thank you. Dr. Taylor, how do mRNA vaccines like the COVID-19 vaccine work?
Okay, thank you for the question. So I'd like to start off by saying, again, like all vaccines, the COVID-19 mRNA vaccines have been rigorously tested for safety before being authorized for use in the US. And this technology is mRNA. What is that, you might ask? Well, that stands for messenger RNA, which is technology that's new, but it's not unknown, as they've been studied for more than a decade and are used in certain clinical settings such as gene therapy and cancer treatments. And I have to note, please, because this is just out here in the world, mRNA vaccines do not contain a live virus and do not carry a risk of causing disease in the vaccinated person. Okay, that's important to note because some people just believe that to be true, and it is totally false. So I'll continue. So messenger RNA vaccines are a new type of vaccines to help us against this infectious disease. So traditionally, to trigger an immune response, many vaccines put an attenuated or weakened or an inactivated germ into our bodies, but not messenger RNA. Messenger RNA vaccines instead teach our cells how to make a protein or even just a piece of a protein, and that little piece is what's going to elicit the immune response inside of our bodies. And that immune response, which our bodies, react to and make antibodies, is what protects us from getting infected from the real virus if it were to ever enter our bodies. So basically, the COVID-19 messenger RNA vaccines give our cells instructions to make a harmless piece of protein. You all may have seen it on the news, the spike protein, which is found on the surface of the SARS-CoV-2 virus that causes COVID-19. And okay, so the COVID-19 vaccines are given or administered in the upper arm, similar to a flu shot. And once those instructions that are in the vaccine enter our cells use the same the same building blocks, the amino acids of our proteins that we make in our regular body. That's what's being used to recreate this spike protein that's found on the cells. So I have to back up. So we're not getting a piece of a COVID-19 spike protein. We're getting the instructions to make that protein. So our body makes this protein, and then it will come out on the surface of a cell. Once that happens, our bodies are going to be like, hey, I've never seen this protein before. We got to kill it. So before that happens, without going into all of the biological processes, our bodies will see this protein as foreign and program that cell to be killed. But before that happens, our body has to remember what that protein actually was, so that, if we were to come across it again in the form of COVID-19, we will, we already have antibodies made to attack and kill those cells. And I want to say this too. One of the biggest things is this: these viruses, oh my God, they replicate so fast. They want to live. They need a host to live. They need humans to live, and they replicate fast. Okay, very fast. Faster than our bodies can, build an immune response, and that's why, unfortunately, some folks, succumb to this horrific disease. So, what this vaccine, which I also have received both doses of Moderna, and I feel great. What it's basically doing is giving us a head start. Okay, it's not going to say, hey, it's going to prevent us from getting COVID-19, but what it will do is certainly, ensure that our cases aren't going to be as severe as those folks who are not vaccinated. And what does that do? Not only does that help keep our families and communities safe, it also lessens the burden on our healthcare system, because we've got doctors, nurses, and other ancillary staff that have been pulling triple shifts and quadruple shifts and just no break, because our healthcare system is overwhelmed. So just think of these vaccines as getting a head start, just in case we come in contact with the virus, to actually beat the virus. One other thing I wanted to say too, after that, is this. I failed to mention it earlier, but some exciting news from Johnson & Johnson, as they filed an emergency use authorization for their single dose vaccine last week, I believe on the 4th. And oh my God, the data is so promising for this vaccine. And not only is it a single dose vaccine, it doesn't have the same cold storage requirements as these others. So these vaccines can be administered in the physician's office setting. So we're hopeful that this will get approved by the FDA very soon and be made available, so that it can help kind of narrow that gap and disparity in overcoming the shortage right now of the vaccines for COVID-19.
Before you go, Dr. Taylor, I know somebody's out there thinking, well, should I wait for the Johnson & Johnson vaccine? What would be your response to that?
My response to that would be no. Because there's no guarantee that it will be easier to get. There's none of that. I would say, hey, don't take away your place in line. If you've already registered and you're waiting, please don't wait for this new thing. The ones that are out right now are working just fine. Like I alluded to, that's a great question, by the way. Like I alluded to earlier, I had both doses of the Mrna vaccine, and I had a little bit of arm tenderness, low-grade fever. First couple of days, I was tired. After that first one, I'm not gonna kid you, I was like, ooh, I was so tired. But those were it. After a couple of days, it was over. But please, no, don't hold out for that, because it could be available in a month. It could be available in July. We don't really know, but it's on the horizon, and it's closer than the other manufacturers that are out there throwing their hats in the ring. So please don't try to wait on this one.
Okay, thank you, Dr. Taylor.
Very well.
Dr. Hackard, I'm getting a lot of questions in the Q&A session that I think you'll be able to answer slam dunk. The county health departments across the US have just been given this massive responsibility of trying to vaccinate as many people as possible. And I know you've been working really hard at the health department to get as many shots in arms as you can. And so the common questions that I'm seeing come across are those three you see on the screen. How do I sign up to get a vaccine? Will I have to pay for it? And does the health department have access to enough vaccine to treat everyone in the community?
So those are all great questions, and I've been kind of furiously typing under the question and answer banner as well. But how to sign up to get the vaccine, the easiest way is if you have access to the internet and you feel comfortable with that, it's to go on GC4 me. It's the number 4, GC for Genesee County, for me, ME. And you'll see at the top a little sign that says register for the vaccine, pre-registration. And it asks a series of questions. The only ones that are absolutely imperative to answer are age, date of birth, and I believe one more thing, but basically the other questions are optional. And what we use those for is to try and make sure that we are meeting the 2 different groups of people. One are the people who are at highest risk for severe illness or even death with catching the virus. And then on the other side, we're trying to also approach it for the people who are most likely to be able to be, or to be exposed to the vaccine and cannot protect themselves with social distancing, mask use, and like ventilation. And so those are the 2 different groups. We've had an amazing help with vaccinating all the healthcare workers through McLaren and the other 2 hospital systems in the county. So really we are still reaching some of the healthcare workers who are now deciding to that they do want the vaccine. They've had some time to think about it, see other people's reactions. So please don't hesitate if you are one of the healthcare workers who had been offered it earlier, but had chosen to wait a bit. Call us, register, you will get a vaccine. And so that's one group. There's other healthcare workers or other people who do things that are physical touching, like a massage therapist or physical therapist that may have their own practice and they're not associated with the hospital system. So those people, we also urge you to reach out. But in general, you sign up there. If you don't feel comfortable signing up on the internet, you would prefer to speak with a live person, there's 2 different ways as well. And I'm going to look over here on my notes because I don't have these numbers memorized. The senior centers and the Valley Area Agency on Aging, they have a phone number for people who would like to just call them if they're a service you already use. But even if you don't use them, if you're 65 or older, you can call this way and they'll do the pre-registration for you over the phone. Their number is 810-239-7671. In addition to that, you can call the health department, and that number would be, more papers, 810-257-3612. That one, I am going to warn you, is a very, very busy line. You may be asked to leave a message and people would call you back. I really urge you to call one of the senior center, though, number if you are in the 65 and older group. And they probably would even register a healthcare worker too if you did not have access to the internet while at home. But if you do have access to the internet and you just don't really want to do the survey, you can also just put your information in. This is the email address and it comes up, info, I-N-F-O, at gchd.us. So we're trying to make it as painless as possible. I know it hasn't been. We also have a couple of things just to tell people, and I was typing some of those in the question and answer, is that we've identified as we go along where the problems are, where are the bottlenecks, what's happening. So I know when we first got the vaccine, so I don't know if everyone realizes it, but I started on January 5th. And as I mentioned, I had previously been with Henry Ford in another county. So I started January 5th and we identified where the problems were. We started to get the larger quantities of vaccine and wanted to do these mass drive-through clinics. But we also didn't have a way to be very subtle about it. So we did what we could, which was put on a scheduling system that shut down very quickly. Let me just say it was not all entirely US internet traffic. There was other traffic that could be identified from outside of our country. And that was then sent over. That's why we switched over to the county-based website, because they had a larger capacity for that. So that's been resolved. But we've also been able to implement this survey and Excel chart, which is now over 40,000 people on that. And we are able to track it that way. I know I was asked in one of the questions, why aren't we getting a confirmation email or something? And we just don't have the manpower yet. We are working on it both two different ways: a database that will make it so that we can get that information. If should we need a booster dose next year or some other time, we would be able to have that information for you. We just update it as though you're going to a regular doctor's office. And the other piece of that is that we that database would also then allow us to send out an email confirmation, or ideally even leave a text or a phone call, but it's probably going to be email confirmation that you are indeed on the site. So those are some of the questions. I know I answered more than you asked, but go ahead and ask the rest.
So one of the things that is coming up is, will they have to pay to get the vaccine?
So the answer basically is no, but it's a qualified no. We do ask that if you are insured, that you provide your insurance. I even had called the state when I first heard that. I said, are we really charging an administration fee? And they had said, yes, we do ask that people put down their insurance. And if you have the insurance, then we would bill the insurance. That's the directions. That being said, if you have that, you do not have to pay a co-insurance fee. You don't have to pay any deductibles. You don't have to pay anything else. So that is what it's being used for, to try and offset the cost, because this is something that is we are all going to be paying in some way or another. But anyways, it is nothing that's going to be out of pocket. And if you have no insurance, just put no insurance and you still will receive the vaccine.
One of the things I've heard you talk about in other meetings that I think would be important to address in this one is the difference between you and Meijer. Because I have a question now that's saying that Meijer now administers the vaccine and they want to know, is it safe?
Absolutely safe. Absolutely. If you are offered a vaccine through Meijer, I urge you to get it. And there's two different Meijer programs, and that's, I think, what you're talking about. It's confusing to everyone. I wish they had called it a little something else, but the two different programs is a federal level program that offers some additional doses to states that they can have, and stand up is like the emergency response code, but they can take that small amount. It's like 3,000 to 5,000 vaccines a week, but they can give it to different Meijers where the county has been hardest hit, either currently or have the highest risk people of getting exposure. And so they move those around. So that is not something that the county is really necessarily made aware of. It's a federal program that goes to the state. The state determines which of the areas, like the 3 to 5 Meijers in the state, need it the most. And then they do that in those locations. So they can change from week to week. The second program is what I am really looking forward to, is when we have enough vaccine to be able to directly give some from the state to Meijer, to CVS, to Walgreens, to all the pharmacies, even Kroger pharmacies, Target pharmacies, all the places you can now get like an influenza vaccine. Eventually we'll be able to get the COVID vaccines, and we'll start to be able to provide that to everyone, all the people who are right now at 16 and up. So that's what all of us in public health are longing for. But right now there is a very limited amount of vaccine. It's going up. So take heart and, hang in there we have patience, but the numbers are going up. The numbers are consistent or going up, and we will all get through this together.
One more question for you before you leave. It again is coming from the Q&A section, and they are asking, how do you guys deal with people who don't show up for their vaccine shot? What do you do with those appointments?
It's surprising how few we have.
Mm-hmm.
And We'll take at around 4 o'clock or about an hour before we are planning the clinic to end. We will call our immunization team, and we will tell them the number of no-shows or cancellations. If they're cancellations, we do it earlier in the day, but if we've had no-shows for appointments, about an hour beforehand, we let our team know how many no-shows we've had, and then they go back to the priority list and call people and ask if they can get to the clinic site within the hour. So that's how we are doing it. I've seen on different news reports, you know, the people hanging out outside the gate hoping to be able to get one of the ones that are not, no one showed up for. And we don't actually do it that way. We actually take people off of our priority list. And if someone's not, you know, able to get there in an hour, they still would be like next up for when we have the vaccines again. They don't lose their spot in line just because they can't get there in an hour or less. But the people may get a little boost up on, you know, someone who's going to get it next week may be offered it tomorrow.
Dr. Reynolds, I see that you have your hand raised.
Yes, I do. And the concern is this: the vaccine is an essential part of our protection against COVID. It's an essential part of preventing the spread, but it is an important, essential part, but is one part. We still must wear masks. We still must observe physical distancing. We still must wash our hands. And so if you go somewhere and it's more crowded than you expected, or people aren't wearing their masks, use that other layer of protection, your brain, and leave. If people try to pack your house, you can tell them no, don't come in. So we still have to be prudent, and then we still have shared responsibility, and that is getting there to get our shot. When we get the system set up, we should be through these bumps in the road, but communication, making sure you're hearing the proper information, because that can undermine everything. But we still have everything that we did before the vaccine, we have to do after the vaccine, because this is a new virus and we're learning more about it, and we're learning more about the vaccines. So be honest with yourself. You've heard the message. Continue to do those things.
That is so true. And that's something that when we get on the conversation of vaccines, it does kind of lead you down that primrose path of vaccines. But these are amazing vaccines. They are way more effective than we had ever dreamed about, you know, a year ago even. Thinking that we would be so audacious as to expect a 90 to 95% kind of effective vaccine is amazing. So they're amazing, but 95% still means 1 out of 20 times that you are exposed to the virus, you may get it.
I'm going to go on to a question that I received from the phone line. And the question is, are there any concerns about people with one functioning kidney getting the vaccine?
I can take that, Dr. Franklin. There's
Okay,
really
Dr.
no concerns whatsoever in somebody who's lost a kidney. So there's no contraindication to getting the vaccine. No worries.
Okay. Another question that I have from the audience is, they registered for the vaccine but received no verification that they were officially registered. How can they be sure that they are actually on the list?
So I lost you for a minute. Not sure what happened there. But I did answer that in the Q&A, and I will, and I believe I addressed it when I was first talking. We do not have the ability right now to do that. We have over 40,000 people on our list. We have 6 people making 3,500 appointments in 2 days. Once we find out how many vaccines we get for the week, this week we had 3,600. They're basically doing that in 2 or 3 days. And so we do not have the ability to do that. If you register and submit it are on the list. And if we find an occasional glitch, we would let people know and try and fix that. But we have not we've run into problems, but not that problem.
Bishop Knox, tell us how you have addressed concerns about the vaccine within your congregation.
Well, since the beginning of the church, we have actually been in our community, we've been the platform in which information was and is disseminated to the community at large. If you look at how the church is actually set up and what we're supposed to do, not only reach man and womankind spiritually, but we're supposed to also share with them things that are of political nature, things that concerns our health. And this issue was like never before needed. We needed to talk about it. The church and its leadership is supposed to inform and to lead, and we tried our best to inform and lead. We tried our best. You see, because Ebenezer, for the past 2 decades, we've spoken over the pulpit about things from HIV and AIDS to hosting cancer institutes. So our church has always had an open ear to healthcare issues and concerns, and to speak those concerns over the pulpit. The COVID virus was no exception. We continue to share with our congregation the need to take care of our health concerns with this pandemic. We continue to host citywide health fairs, and we continue to focus on Black men's health care, heart disease, and our community was overwhelmingly responding negatively to hypertension, and our diabetes rate was up. So at Ebenezer, we tried to stay and keep our church focused and the community focused on healthcare concerns, not just spirituality. We were fortunate enough to have a healthcare advocate be a part of our membership. Her name is Yvonne Lewis. She's a healthcare advocate in the city of Flint and in the community at large. And then we began to work with her and share with the pulpit the need for flu vaccinations. And I would be the first, the guinea pig, so to speak, who would get the shot. And then we would share with our congregation. We share with them how I would feel afterward. We would share with them each and every time flu season came about that I would take the shot first, to let the congregation know that this is okay to do. So the same thing happened with the COVID-19 vaccinations. I led by example, and I was able to get the word out each and every week of my progress. I took the shot, I recovered. The second shot, I told them if I didn't come back online, then follow suit. Don't take that shot. But I made it back, and I had a slight headache, and afterwards, slight fever, and I'm able to be on this platform on tonight. But the main reason we were able to reach our congregation is because we're not afraid of the science. Mm-hmm. We then work with someone in our church to create a social media platform. Her name is Rna McKay. This lady was able to get the word out to our congregation week after week after week and create an online platform for our church to continue to move forward. This past summer and fall, we were able to teach seniors to use their smartphones, their tablets, and their computers through a program that Rna McKay was able to create so that we wouldn't leave the seniors out and we could get the message to them. We were able to offer these classes outdoors under our pavilion, and we continue to socially distance ourselves. Now, we continue to consult with our healthcare experts, and we continue to post updates and information regarding the vaccine on our website where, once again, utilizing our social media platform and offering training to those seniors, because I think that's one group that many people tend to forget. They don't know how to register online. They don't know how to use their smartphone. They don't have a smartphone in many cases. So we could then promote. Wish we would have had some stock into Apple when it first began, because we're promoting Apple and those smartphones and those computers to make sure our seniors stay abreast to what's going on in the healthcare field and with this virus as it continues to change day after day.
And I think it's important too for children to look out for their parents and grandparents and aunts and uncles and neighbors. If you know that there's somebody around that may not know how to access the information and you do, why not be a blessing to them? You know,
Yes.
I think that is very important. I think we've gotten out of the practice of doing that, of just being kind to one another. That would just be a measure of kindness. And all my patients that come in who have told me that they wanted to register, I register them right in my office. I get the computer out, I sit them down, we log them in. I make sure that it goes to an email address that they can have access to or somebody that they trust. And that was one of the things I liked about what McLaren did on their website is they said your email or email of somebody you trust, because some folks don't even have email, you know, but if you sent it to their child's email address, that would be a way to get them into the system.
Beautiful. Thank you.
Dr. Reynolds, will the vaccines that are out there now protect against this new COVID variant that we're seeing that's now been confirmed in the United States?
As best as I have learned, yes, it can be protective. Depending on how many more mutations there are that we know about, it at least should prevent severe disease. But time will tell. And just like with influenza vaccine, the components have to be changed every year. So it's a evolving process. Some of these mutations really don't result in anything significant, but a combination of mutations, and this is just what viruses do. So we will have to be, and when I say we, I'm talking about our public health system, the Center for Disease Control, the FDA, will have to continue to monitor these things. And what I would like to bring up, it's kind of related to that, is you still need to be tested. While you're waiting for the vaccine, if you have symptoms, you need to get tested. If you've had contact with someone who's COVID positive, you need to get tested. And if your symptoms, the side effects that we talked about, fever, headache, if those problems persist, I'd say more than 3 days beyond your immunization, you still need to get tested, because it does take a couple of weeks for the vaccine to start to kick in. And I'll turn that over to my adult colleagues if they want to expand on that. But get tested.
Dr. Perry, your question that we have on the screen has already been answered. So I'm going to pull from one of the Q&A questions that I see. And it is, if you are wearing a mask and are around people who are not wearing a mask at all or not wearing it correctly, are you getting protection from your mask wearing?
Well, one way I can answer that is that if I'm wearing a mask and I'm around others who aren't, I run the other way. And I've had both doses of the Pfizer. But all that said, the reality is that masks work. They do work. So they work best along with social distancing and with everyone else wearing a mask. So they protect both ways. So this is transmitted through aerosols and droplets. So when I'm wearing my mask, when I inhale, it does filter out a good part of any particles that are in the air and keeps it from getting into my lungs, into my mouth. When I exhale, if I were to be positive for a virus of any kind, it absorbs a good part of that, so very little of it gets out. But the masks aren't perfect unless it's an N95. So the simple answer to your question is that if I'm wearing a mask and I'm around others who aren't, it does protect me, but not 100%.
Panel members, we are at the hour mark. Do you mind going a few more minutes to help address a few more questions? Okay, thumbs up, I'm seeing, okay.
Yeah.
Mr. Arsencio Zucaro, what resources are available at your facility to assist community members who have questions about COVID-19?
Yeah, Yes, absolutely. So here at the right at the Latinx Tech Center over on the east side, we are really just one of many nonprofits that are doing really just, I'm impressed by the amount of organization and the spirits of organizations that have uh, really gathered together to do the best that we could as a community to address COVID-19 and this pandemic. But our organization is really a resource center, right? It's one of the biggest things we do when people come here or call us or email us, is we want to make sure that if you have a question, that we connect you to the correct organization, institution, or even give you a response or a service ourselves. But that's the biggest thing, right? Like I said, we see a lot of community members, a lot of families that have some financial instability right now, and I'm so grateful that we've been able to connect them with other organizations that could help them with rent assistance or utility bill assistance. And then here specifically, like I said, we had families that reached out to us and had concerns about their children's education and how to support them. And I'm glad we're able to provide virtual tutoring. So that is a resource, right, for any families that need or would like that extra academic support right now. Contact us. Our website is latinxflint.org. And you can find our information there. But as well, we've been doing a lot of great work for a really long time. Every Wednesday, there's another organization, the Marta Sluga Food Pantry, that gives out food here at our center every Wednesday morning. And then every Saturday, we do water distribution here. And then as well, we also do mask distribution, right? If every time you need a mask, water, food, water filter, that's exactly what we're here for. But lastly, like I said, that information sharing is something that we try to do and address, right? Being connected with the community, we know that there's a lot of questions, just like we answered today, and a lot of concerns, a lot of issues of trust, just given the dynamic of people's experiences here living in the United States. But we try to address those, and then as well with any language and culture barriers, we provide those translations and interpretation services that we work with the county health department to make sure that to register for the COVID vaccine was going to be accessible. But lastly, like I said, we are one organization of many doing just some really great work, and really grateful to a lot of our funders that have really stepped up to to address the needs that need to be met from the community right now.
So may I just, this is something that I think is hot off the press. I was at a site visit today for Our Lady of Guadalupe, and we will be holding a clinic there, I believe next Friday. Literally, we were just planning this now, but I believe it's going to be next Friday. That will be specifically outreaching to the Latinx population, and very excited about that.
That's very nice.
I have a question from our chat box, and they are asking if you've been, or if I've been completely immunized and I am friends with somebody who's in the same situation, is it safe for us to do things together?
I can take that one, Dr. Franklin, although there's no good answer for that. That's a common question that comes up, and it kind of dovetails into the question about if I've had the vaccine, do I still need to mask, et cetera. Dr. Hackert had said, and we know that from what's been reported with the mRNA vaccines, that they're 95% effective, which means potentially 5% not effective. So if you all have been immunized and it's been 2 weeks past your second dosage, there's a good chance that you're not going to be likely to contract the virus, but there's a small chance you could. It boils down to bubbles. I think throughout this whole thing, we've seen people define their bubbles, and the bubble is defined by how much risk you feel you're at if you were to contract COVID, and how much you have to survive by being social or being with others. So I have patients in my own practice that have a bubble that's about as tiny as you can get, and others who have defined their bubble as being quite large. So the same thing applies once folks have been immunized. And I think that to get to that point where we're all immunized to the point where herd immunity takes place, and we get this virus beaten down to the point where we're getting annual boosters for the variants, and we are looking at it like we look at influenza in a sense, we can then again get back to our life without masks, without social distancing, and we can start hugging one another again.
I'm a hugger. I've been having a hard time. Well, I appreciate you guys staying on for a little bit longer. For the additional questions that we didn't have time to get to today, please don't hesitate to go to mclaren.org/Flint Fight COVID. And there's a form there and you can submit your question. And someone from our medical team will be responding to those as early as tomorrow. And, I like this little message that's at the end. Don't miss your shot. The pun is absolutely intended to stop COVID-19. Right now, the vaccines that are out there, either one of them, they're both good vaccines. Give us the best shot of beating this virus. Thank you.
Thank you.
Dr. Lauren Reynolds, you have a question or an answer.
And don't miss your chance to get tested also.
Absolutely. Absolutely.
One more from without doing my video. Put your name on the list, even if you're hesitant, because it will take weeks, likely, depending on what group you fall into. But if you put your name on the list and your name is called, you can say, I'm still thinking about it if your name comes up, and you will still be holding that spot a little bit on there. And so please put your name on the list, even if you're just considering it at this point.
Did anyone else have any final thoughts before we say goodnight? Panelists, thank you so much. You have been amazing. You have given us some wonderful information. You have really helped boost vaccine confidence through community engagement. And that's how we get the community to trust medicine again. I appreciate you all. Thank you so much.
Thank you for having us.
Thank
Yep.
you, Dr. Frank.
You all
Good
for
night.
attending.
Good night.